The Ebola outbreak continues in West Africa as international leaders and health organizations struggle to help those suffering from the deadly virus. Joining us now with more on the challenges of containing the outbreak is Dr. Frank Esper. He is with the University Hospital's Case Medical Center of Cleveland. Doctor, welcome to the program. Wish it was on better terms, certainly. Ebola is deadly, but thankfully it's hard to pass along. You have to have prolonged exposure generally with fluids from the body. How much do Americans right now, before we get into West Africa, how much do Americans need to worry about this?
You know, I think that from the virus standpoint, the virus is for the most part contained to those areas that are very close to West Africa and to the African continent itself. There really has not ever an epidemic outside those particular areas. We believe because the vector, because the reservoir for this virus is some sort of animal within that geographic region. And so we do not believe that we actually have the animal reservoir to actually provide Ebola here, nor even if we brought people who have Ebola to this country, would it be able to become established. Are
you surprised by the rapidity of the spread of Ebola in West Africa?
You know, Ebola is a very, very dangerous germ. It is something that, while there is a bit of a window where people are okay, when the infection becomes established, people get very, very sick very, very quick. I think the problem right now is that the reason that it is spreading as much as it is because even in these remote areas, over the last several decades, these remote areas are becoming areas where people are able to move from one place to another with much greater speed and much greater distance than they had in the past, and that's one of the reasons why we're seeing it spread as far as it is.
We want these doctors, these U.S. aid workers that have been brought back to Emory Hospital to get better. Do you support, though, as difficult as it is, that decision to bring them here for treatment, putting Ebola on U.S. shores?
You know, I do. I believe that this is something that is very extraordinary because it just shows that as a people, as a nation here, we are not so risk averse that we are going to let those Americans stay in an area where we cannot provide them the adequate care that we are able to do here in America. And so we have the protocols, we have the facilities already established just for this kind of event. And we have the ability to go in and extract those Americans and bring them here. It just tells us that as a medical community and as a nation that we are up for the challenge and that we are not going to let them, stay, overseas because we are too scared that we are not able to contain this virus. We have very strict protocols, and those protocols are established before these patients arrive, while they're here, and then even after the resolution of their infection. We are going to have all these protocols all set from the most physicians to the nursing staff to the people who take the garbage out of their of those rooms. Yeah. Everyone's going to be on the same page in controlling and containing this infection.
And hopefully learn more about it to finding a permanent cure for this disease. Dr. Frank Esper, yes. University Hospital's Case Center of Cleveland. Doctor, it's a pleasure. Thank you.
All right. It's very good to be here.
All right. Coming up,